Hi there everybody, it's Dr. Steve here with Kinesi, and this is your Start Your Healing Now, what to do and where to start. And today we're talking about back pain, but particularly disc issues. And so back pain can be coming from all sorts of different sources. Discs are one of the common things that cause problems, and the pattern that most often we see with discs, they don't like sitting, but they like standing and walking. So there's another term called stenosis, and we did some videos just a couple of weeks ago for that, where that stenosis tends to be the opposite presentation. It does not like walking and standing, but gets relief from sitting. So discs being a little different, we're gonna go after working on that. So speaking about sitting, the first thing that we're gonna do is talk about a little bit of the sitting mechanics. And as we sit, we as humans are pretty good at slouching. And that's where we are efficient machines to a fault, meaning the body always wants to conserve energy. And by turning everything off and slouching, we're conserving more energy because things are not as active, they're not as engaged, we're not maintaining our posture as much. But part of what happens is we fall, we kind of roll back on the sacrum, onto the tailbone, and that's putting the spine into kind of a tough position there. And so one of the ways to work with that is a little wedge under the seat. And so different than just putting a pillow behind your low back to kind of fill in that space, a wedge really changes the position of the pelvis dramatically. And so it feels a little funny as you first sit on a wedge, but it really does just kind of force you to stack the spine up a little more efficiently. But it tilts us forward. We want the hips, ideally in a perfect setting, the hips are a little bit above the knees, and with the pelvis tipped forward, that's a bit more of what we can get. The quads are a little more engaged because it's keeping you from falling forward. But again, having the quads turned on and having the pelvis tipped forward lets the spine stack up a little more efficiently and tends to be an easier way to maintain posture versus from the slouching that we can do when we're sitting. So using a rolled up towel or something like that can be a convenient way to work on that. Carrying on with the sitting, one of the things that happens when we sit so much is at the front of the hips, the hip flexors get really gummed up, they get tight, they get restricted, and it's like as we're seated, all the folds of the fabric get kind of glued together, and you go to stand up, and very often it's, it takes a little bit to get up and to get moving. So we're gonna do a hip flexor stretch in two different ways. We're gonna first do one where we're just standing with one foot forward, one foot back. Hanging on to something is really helpful because you can do it where you're not hanging on, but then the body is looking to not fall over, and so it's gonna make things a little bit tighter. When the body senses, oh hey, we have something here to hang on to, we're pretty stable, then it's gonna let you get more motion out of all of this. And so what we're doing here is we're taking the hips forward and back. We're stretching out the hip flexor of this back leg. We're gonna have the toes pointed forward, and then we're gonna hit the three directions. We do side to side. We do the circles both ways. And then we switch legs and repeat. So the three directions, we do the forward and back. We do the side to side, and we'll go in circles both ways. This is the easy version that you can do anywhere and everywhere with both feet onto the ground and one foot in front. And we're in this stride stance getting a hip flexor stretch for this back leg. Now you can take it up a notch and you can go a little further where you put your foot up onto an elevated surface. So if we put one foot up onto a chair and then you have, like as if you're in a doorway and you have the door jambs to hang onto, now we have a little bigger stretch for the hip flexor. Same deal, that we're gonna take the body and we're gonna go in the three directions. We do the forward and back, we do some side to side, we go in circles, we try not to have the chair roll away from you, and then switch feet and repeat. So very often I talk about these in a 2-minute stretch format, and the 2 minutes comes that we go in 3 directions. So if we do 20 seconds forward and back, 20 seconds side to side, and 20 second circles, there's 1 minute, you switch sides and repeat, and in 2 minutes you've just gotten yourself a really good hip flexor stretch. So that's where we're going to start for helping out your disc issues in your low back with a little bit of sitting posture education. Sitting on a wedge makes a difference, and then stretching out those hip flexors, whether you have both feet onto the ground or 1 foot elevated a little bit. So be sure to stay tuned for part 2 and part 3, where we're going to take these movement strategies a little bit further and take them a little more global to incorporate the rest of the body. But if you or anybody that you care about is suffering with some back pain, don't let them suffer. Let's bring them in, let's talk about what's going on, figure out what their body needs, and then get them on a plan moving forward to feel better and function better. So be sure to stay tuned until next video, and I'll see you then. Bye-bye.